diabetes can affect the brain actually in many ways, and dementia is one of them. Diabetes can also, just like it affects the heart, as you said, can also affect the brain. So the blood circulation to the brain can also get affected due to a stroke, either a hemorrhagic stroke or a thrombotic stroke or something. So when you have stroke, you can get brain, and that diabetes is one of the causes of that. Just like blood pressure is also caused, diabetes is also caused. But here we're talking about dementia. Dementia is of different types, and we'll talk about that later. But overall, if you see dementia, which is loss of memory, loss of cognition, it can be due to many causes. But all types of dementia are more common in people with diabetes because diabetes is a condition of accelerated aging. We know that aging occurs at a particular pace, but in the case of diabetes, it occurs a little faster because of many conditions, because the cholesterol levels can be high, the glucose itself can be damaging, there is more inflammation, then there is decreased blood circulation to the brain, oxidative stress, many reasons why people with diabetes can have increased incidence of dementia. So to put it very simply, suppose you are 60 years old and not having diabetes, then your biological age and your chronological age. Biological age is how old your arteries are, whereas the chronological is your actual age. So both are very close if you are not having diabetes. But if you have diabetes, your biological age can be much higher than your chronological age. So you may be only 16 as far as your birth certificate is concerned and as far as your actual age is concerned. But if you look at the arteries, the nerves, the arteries, and so on, maybe like a 70-year-old or a 75-year-old. That means there is accelerated aging. So the biological age can be much higher than the chronological age. And that's what happens in people with diabetes. We have found that generally about 10 years diabetes adds on to your age. And so naturally we know that when people grow old, their brain cells begin to degenerate a little bit. And in the case of diabetes, when that is accelerated, then the prevalence of dementia goes up very much in people with diabetes. So if you talk of dementia, there are different types. There are about 3 or 4 types of dementia. You mentioned the 2 most important ones. Of course, Alzheimer's disease, where there is degeneration of the brain and formation of certain plaques in the brain, amyloid deposits, and a certain other fat deposits. All these kind of things can get actually deposited on the brain. Once it gets deposited in the brain, they form kind of tangles. It's like hair getting tangled or something like that. The nerves start getting tangled. Then it cannot flow. The information cannot flow properly. Your memory goes down, your cognition goes down, your judgment goes down. All these things happen. And that degeneration, the one type of dementia, is what we call as Alzheimer's disease. And Alzheimer's disease is definitely more common in people with diabetes. It's supposed to be double the prevalence of, suppose in the general population, there's 20% having dementia. In diabetic people, it will be 40%. So it's double the risk of having Alzheimer's disease. The other type of dementia is called as vascular dementia. So the blood vessels start getting, here in dementia, Alzheimer's, it's only the nerves getting affected. The blood vessels are not affected. But if the blood vessels to the brain, the cerebral vessel, if they start getting affected, it's a different type of dementia called as vascular dementia. That is also more common in people with diabetes because vasculature gets affected in diabetes. That is why the eye, kidney, heart, feet and all which you mentioned earlier, they're all because the blood vessels get damaged. Similarly, in the brain also the blood vessels start getting damaged, then the vascular dementias are also more in people with diabetes. Of course, you can get mixed dementias also. You can get Alzheimer's plus vascular. That is also more common in people with diabetes. So all forms of dementia are more common in people with diabetes. The usual symptoms are the kind of age-related symptoms. So we are not sure whether it is dementia or whether it's a normal aging process. People start forgetting names of people, and above 60, 70 is very common. And people say, I know that guy, but I'm not able to get his name, So that will be the thing. Similarly, Whether they had their breakfast or not, they may start forgetting. Or they keep their key somewhere, they don't know what is. They'll go into a room and they'll say, why did I come to this room now? Those are early stages. They are mild cognitive impairment. You ask them to draw a line or you ask them to do something, they're not able to draw. You tell them draw a clock and show 11:10 in the clock. They are not able to do that. So small things like that will start. Then serious forms of dementia will come where they start forgetting who they are also. They'll forget their wife, they'll forget their children. They won't know, when they see them, who they are. So those are more severe forms of dementia, more advanced stages of dementia. Earlier, of course, by doing MRI scans and all that, you can see certain changes in the brain, and then you can predict that maybe some parts of the brain are degenerated. Today, we have got biochemical tests. There are some biochemical tests by which there are markers of dementia. So those blood markers, just like checking cholesterol or checking sugar or checking your insulin level or things like that, you can measure these biochemically in the blood in a lab. And if it is higher, the values are very high compared to the normal person for that age, you can say this person is likely to develop dementia. And these biochemical tests become abnormal even 5 years or 10 years before you actually develop dementia. Okay. So you can predict who are the ones who are going to get dementia. And there are many ways of treating dementia, through diet, to exercise, through mental games, to Sudoku games. So many things you can do to keep your mind and your body physically active. So these people are going to get it. You can probably give them some extra attention and so on. And also under development, almost it has come. One or two of them already been approved now, are drugs for dementia. I mentioned that amyloid deposits, amylin deposits, and these neurofibrillar tangles in the brain, all those things I mentioned. Today, there are medicines which will dissolve those kind of clots or the plaques which are formed in the brain. They can actually dissolve them. And then your memory can come back. Your dementia can go and you can start remembering things and all that better. Those drugs are also coming. So what we can do now is we can do the tests to find out who is going to develop dementia, take extra precautions to see that they don't develop dementia. And if they have dementia, then we can start giving them treatments also, whereby the dementia improves. And sometimes it can be just some mild psychological tests of games which you can make them play. And then in the more severe cases, you can actually give them drug treatment for the dementia. So that is the reason why we are able to detect it years earlier and then take some treatment. We don't have very many large studies which have looked at that, seeing whether by controlling diabetes, you can slow down dementia, or if you have dementia, you can reverse it by good control of diabetes. We don't even know whether by good control of diabetes, the biochemical test that I told you, whether they will start decreasing. We propose that is the case, and we'll have to put up a hypothesis and now study that and see whether it is actually true. But one thing I do know, that among my people with the diabetes whom I am treating, among my patients, there are some who's even after 90, 95, even 100 years of age, they are still physically fit, mentally fit, and they are able to, their memory has not gone, they've not developed dementia, and they're doing very well. Whereas there are others who at 60, 70 itself, they are getting dementia, and by 80, they're completely gone. They're not remembering anything, and they have very severe case of dementia. When we looked at what are the factors which differentiate those who are doing well and those who are not doing so well, it turned out that the A, B, C, D mantra seem to work very well. A stands for A1C or HbA1c, 3 months control of sugar. If that's kept under control, it's good for you. B is blood pressure. So if you keep your blood pressure under control, that also helps. C is cholesterol, the bad cholesterol. If you're able to keep the bad cholesterol down, it prevents dementia. And D is discipline. You need some diet, some exercise. You must go to sleep on time, go for checkups regularly. All this seems to help. So in all people with diabetes, the A, B, C, D is followed properly, then dementia can be slowed down and the other complications can also be prevented. Indians are known to develop diabetes at a younger age, blood pressure, heart disease, everything at younger age. And there is some evidence that maybe even dementia is coming at a younger age. And as I already said, people with diabetes have accelerated aging, and therefore they've become a good model to study and to treat dementia. So the Center for Brain Research at the Indian Institute of Science and the UK Dementia Research Institute, or the UK DRI, we have been in correspondence with them for some time, and we've had discussions. So UK DRI and Center for Brain Research had already signed an MOU, and we were very keen to start doing research with them. So we signed 2 MOUs, one with the Center for Brain Research, the other for the UK DRI. And through this 3-way collaboration now, we have scientists in UK who are good clinicians. In the Indian Institute of Science, we have I told you about the biochemical tests which can detect dementia early. So those tests have all been set up at the Center for Brain Research. And they are willing to do it free of cost for us in our patients whom we suspect that they may be having dementia. So, and we have the diabetic patients. So therefore, we'll be sending some blood samples to Bangalore for Center for Brain Research, find out these biochemical markers for dementia, and then run various intervention things, control the diabetes better, give them healthier food, and see whether we can actually prevent dementia in them. Now, the dementia experts in the UK Dementia Research Institute, they provide the technical support, how to screen for dementia, who to screen for dementia, and how to treat the dementia, and to set up kind of dementia clinics so that people who come now we just say, oh, he's an old person, so his memory must be failing. We don't take it seriously. But is there something we can do to preserve the brain function, to prevent dementia? That is a long-term goal, because India's lifespan is increasing. Life expectancy is increasing. At the time of independence, only 35 years. Today, it is 70 years for males and about 71, 72 years for females. So, and it's going to grow to 80, 85 years. In China, Japan, and some other countries, already the mean life expectancy is above 80, 85 years. In India, also very rapidly, we'll reach there. So when you reach there, because people are living longer, we are going to have much more of dementia. So now is the time to start looking for it, start screening for it, and to try to prevent this dementia. So all that is what is part of this collaboration between Madras Diabetes Research Foundation here in Chennai, Indian Institute of Science Center for Brain Research, and the UK Dementia Research Institute. What I would like to say is that at our center in Chennai, and we're trying to send it to all the branches across, whenever anybody above 60 years of age comes to us, we do a free test for dementia screening, not just for dementia, but also for aging, and look at the physical strength and muscle strength and look at memory. So we start testing all that. By doing that, even if the patient does not complain that they have got memory loss, we are able to detect it. And then we are trying to set up a healthy aging clinic whereby we allow people to grow old gracefully without a rapid fall in their dementia or the mental status. So that is what we are trying to do. And I think diabetic clinics should now start. It's a good opportunity because people who come here are usually above 50, 60, 70 years of age. So good opportunity for us to pick up dementia early and thereby treat it so that they don't go into advanced stages of dementia.